Good afternoon. My name is Kyle Tice, and I'm here interviewing Dr. Jessica Robinson. Um, so, to begin, what degree did you study in undergrad too?
I was pure pre-pharmacy, and so I did my pre-pharmacy. I took 3 years instead of two to do my pre-pharmacy at West Virginia University, and then moved straight into the pharmacy program.
At WVU?
Yes.
Do you think that it helped you prepare for your current job
Yes.
in undergrad?
Yes, it did. I also had an interest in humanities, and I also had a bunch of different communications courses. I could have technically pursued a communications minor. I just didn't. I don't even know why I didn't do that, but I didn't. But I had a lot of communications courses, and that definitely helped in my career.
All right. Did you have any previous pharmacy experience before starting?
No, I did not start working in a pharmacy until the summer after my first year of pharmacy school. And in that job, I did not do anything pharmacy related. Really, I packed boxes full of pills, and every now and then I would help take them to nursing homes throughout the state. I didn't start working in a retail setting or community setting until my second year of pharmacy school. And I worked at the Rite Aid in South Charleston.
All right. So what attracted you to, I know you are specialized in infectious disease. What attracted you to infectious disease?
It was one of those courses and subjects that whenever I was in my didactic portion of pharmacy school, it just clicked. It made sense to me. It's one of the few types of disease states that for the most part we can cure. Unlike hypertension, diabetes, where we treat, we can actually cure infectious diseases. So I liked that portion of it. I was introduced to what I do specifically, antibiotic stewardship, at the VA in Huntington during a rotation. And that was something I found it very interesting, much more interesting than my other rotations. And so that's where I really decided that I wanted to pursue that as a career path.
And did you originally, going in, I know you said when you had the class it kind of clicked. Did you have any, inclination before that you wanted to do infectious disease? Or?
I didn't even think I wanted to do a residency. I went into P4 rotations, had my first acute care hospital experience that was not extraordinarily positive because I didn't get to interact with the pharmacist. I mainly interacted with technicians. And then I had a rotation at St. Mary's Medical Center in Huntington with a clinical pharmacist in oncology, where I got to see the different clinical monitoring that they got to do and actually did a lot of that myself. And so that's where I really became interested in potentially pursuing a residency.
Where do you see yourself in 5 to 10 years?
I am not a person that has any desire to pursue an administrative role at all. I really like the practice component that I have. Every now and then I have the struggle of, do I want to continue on the academia path, or do I want to go purely into a clinical type of practice? So I think that that's still going to be a question, not that anyone wants to hear that, for me for the next 5 to 10 years, because I really do enjoy my clinical role.
So have you held any other positions that have helped you get to where you are today?
No, this was my first job. And so I graduated from pharmacy school in 2008, and then I did a first year of pharmacy practice residency at St. Mary's Medical Center in Huntington. There, I was allowed to do 3 ID rotations, which really solidified for me that that was the path that I wanted to take. Then I went to Jackson, Mississippi to do my second year residency in infectious diseases, and then directly came back here. This is home for me, Charleston is. So came back here and took the job. I wear quite a few hats in this job. I serve on a national committee right now. It's the Society of Infectious Diseases Pharmacists. We have an antibiotic stewardship program, it's a certificate program. And so currently I serve as a co-chair and was just recently asked to be the vice chair of the committee, meaning I'll be chair next year. So that's one of the, I think, really good things that has helped me branch out a little bit from just the people in the Charleston area to people nationwide.
And with this program and everything, do you have any goals right now?
Within my academic role, we're also looking to expand. I'm looking to expand my research activity. So I'm currently involved in 4 different research projects, which I think will help broaden my exposure in that that area. That's probably the area I'm weakest in at this point in time.
You able to give a brief description of the 4 areas of
Of the research
the
project?
research
Yes. Most of them, or like all 4, are infectious diseases related. One is with the Pharmacy Fellows, which we will bring up next week at our meeting. We are working in collaboration with WVU and also Charleston Area Medical Center to educate physicians about appropriate use of antibiotics in an outpatient setting. We'll be providing promotional materials to the physicians for patients because we know a lot of the motivator to prescribe antibiotics is patient-centered. We are also adding a survey to that, so we'll do a verbal survey as we're in doing that project that the fellows will then be able to use as research this year. I am leading a project on looking at rapid identification of blood cultures for Staph aureus bacteremia and also patients with candidemia. We have a technology that, without pharmacist intervention, it's taking anywhere between 12 to 13 hours on average for an intervention to be made. And so we're about to institute a pharmacy-driven protocol where the pharmacist will be contacted by the microbiology lab. So we're specifically looking at pharmacist impact on patient care. Does it cut the time from that 11 to 13 hours to something less than that? And then I'm involved with 2 other projects regarding Clostridium difficile-associated diarrhea. One with Dr. Cook and Dr. Dispinet, and the other with Dr. Brian Hodges, who is adjunct at WVU, and one of our pharmacy residents.
So is there anything that you wish you knew about pharmacy before you started that you could use today?
I think one thing that I was not aware of was really the number of opportunities that are available for a pharmacist. And so I think typically as students, especially if they don't have significant exposure before entering or applying to pharmacy school, we think of it as the pharmacist that's filling the prescription and that's it. But to understand the various roles that a pharmacist can play in a community setting, an ambulatory care setting, and an acute care setting, we have multiple acute care pharmacists at CAMC, but none of us function in the exact same capacity. And so to understand that, I think would have helped me better define where I wanted to go in my career path early on rather than waiting until the very end P4 year.
Were there any major roadblocks that you hit along the way that you would like to elaborate on?
Trying to think. I really struggled during my PGY1. I did not, for personal reasons, did not want to move away from West Virginia, and knew that I was going to have to. So there was an opportunity to take an internal medicine residency position where I could still be in the state. And I started to apply for that because I didn't want to move away. And as I was applying for it and trying to write my letter of intent, I realized at that point I couldn't do that. I couldn't write about a career path that I knew I didn't want to take. I knew if I was going to pursue a PGY2, that's where infectious diseases is what I wanted to do. And so I think that was probably one of my biggest roadblocks that I had was I have to choose career over personal feelings. And personal suffered because of that, but ultimately I decided that it was important for me to be happy in my career, to be happy in my personal life later on.
And do you think that helped you, moving away for that year? Do you think that, I know you said that you knew you had to do a career, and are you happy with that decision?
Yes, there's not a single day that I regret that decision.
I know you said, you've been through PGY2 and that, but have you ever thought of changing your career at all in any way?
No, the battle I think that people in my position have is, do we move to an academic position or do we move to a hospital position? And so that's sort of where I am. I've been asked before, am I interested in maybe pursuing more of a administrative role? And that's just not in my interest space at all. We had to do, during my PGY1, an administration rotation, and I learned within a week that I had no interest in that. Calling people at 4 o'clock in the morning to staff because your 7 o'clock person can't do it, I can't do. That's just not part of my interest area.
Right. What expectations did you have coming into pharmacy school in general, starting all the way at the beginning? Given the expectations going in
About the career or
about the career.
I didn't really know what to expect. I sort of went from a pathway. I come from a family of attorneys, and I thought that's what I was always going to do. And then a friend of mine's mother pointed out that I have no interest in history and English. I love science and math. So she really helped change that thought process for me. But I didn't really have a lot of expectations. I guess I thought that I would be in the community setting. That was the only place that I ever imagined myself being. After working in a community setting in school, I realized that I don't have the patience for that. I don't have the ability to have my emotions when angry or upset with patients. Not that I would yell at patients, but it was very hard. It was very difficult. And so I think going in, I expected that's what I would be doing. And obviously that changed significantly.
And did you have any expectations going into, once you knew you wanted to do infectious disease, did you have expectations going into your postgraduate years?
I did. I thought that I would be, it's very interesting because in a second year residency, you don't realize really how independent they let you. My residency, I was a very independent functioning pharmacist, which was nice. Within a week, I was rounding by myself with the infectious diseases team. My preceptor never rounded with me. And so that was a scary thing, but it was also very nice because I was forced to learn how to think on my feet very, very quickly as being a pharmacist on the team. And so I had the expectation that we would do more things together. We would have topic discussions more often, do journal clubs. He would check what I'm doing all the time. He didn't. But I'm very thankful that was the situation because I learned early on to function. I know when to ask questions when I'm not sure. He was always there for that, but I learned very quickly to rely on my knowledge when rounding with the team.
Do you have any advice for incoming students that are applying to pharmacy school that you would like to share?
Never rule out a single career path. Never rule out and say that you know that this is all that you want to do. Keep an open mind, but don't let people pressure you. I have a lot of fourth-year students now who are very capable to go and do a residency, and you see that people try to force that upon them. That's not the path that you want to take. Don't let anybody else dictate that. And so I think it's important to always keep an open mind, but stay true to yourself and make sure that you listen to yourself and what you want for your life.
Right. And I know you briefly touched on P4s and that. Do you have anything for current students else that you would like to add?
I think, like for P1, 2, and 3, I think that just keep an open mind as you go through. Talk to as many people as you can. Try to get the insight of as many people as you can. Look at all the different opportunities that pharmacy has to offer. There are some good resources. The American College of Clinical Pharmacy, ACCP, they have a very good career center for students where they discuss the different pharmacy career options and sort of what each entails. Never say never. Never say that you won't do this or you won't do that until you've had the experience. I don't think it's fair to rule anything out. It's interesting because as you meet pharmacists, you'll see that even after graduating, they go from, somebody who works in intensive care to somebody who does drug diversion to somebody who does geriatrics. And in that, different career, how does that happen? So never say never, and just make sure that you keep an open mind.
So anything else you would like to say?
No,
I'd like to thank you for your time and allowing us to interview today. Thank you.
Thank you.